When someone has eaten a potentially toxic mushroom, the actions taken in the first 30 minutes can determine whether they survive. This isn't about having medical expertise, it's about knowing exactly what to do while waiting for professionals to arrive. Every bystander should understand these critical steps. First action, immediately. Call emergency services. Don't wait to see if symptoms develop. Don't try to determine first whether the mushroom was actually toxic. Assume the worst and call 911 or your local emergency number immediately. Time is everything in mushroom poisoning, and the latency period before symptoms develop creates false security. Call now. Second action, contact poison control at 1-800-222-1222 in the United States. Poison control centers have toxicology specialists available 24/7 who can provide guidance while you wait for paramedics. They can advise on immediate steps and coordinate with the receiving hospital to prepare for the patient's arrival. Third critical action, preserve mushroom samples. If any of the mushrooms remain, raw specimens, leftovers from the meal, even vomited material, save them. Put them in a paper bag, not plastic, which makes them deteriorate faster. These samples are crucial for identification, which guides treatment decisions. If you have a photo of the mushrooms before they were eaten, save that too. Now, about inducing vomiting. Don't do it unless explicitly instructed by poison control or emergency services. Traditional advice to induce vomiting has been largely abandoned because of aspiration risk, the danger of inhaling vomit into the lungs. Activated charcoal can bind toxins if administered early, but this is a medical intervention, not something bystanders should attempt. Let emergency personnel make these decisions. If the patient is vomiting, position them correctly to prevent aspiration. They should be on their side, not on their back where vomit could be inhaled. Stay with them, monitor their consciousness level and breathing. If they lose consciousness or stop breathing normally, that's a dire emergency requiring immediate CPR if you're trained. Prepare information for paramedics. They'll need to know exactly what was eaten, when it was consumed, how much was eaten, the patient's approximate weight, and what symptoms have developed. Write this down if possible. Precise information helps medical teams decide on treatment urgency and approach. What not to do is equally important. Don't give milk. The folk belief that milk neutralizes mushroom toxins is completely false and can delay proper treatment. Don't try home remedies. Don't wait to see if symptoms develop before seeking help. Remember that amatoxin poisoning has a latency period where you feel fine while cellular damage progresses. Don't assume that because only one person is sick, the mushrooms weren't the cause. Individual tolerance varies, and sometimes one person in a group gets a larger dose of toxin. Don't let the person refuse medical care because they're feeling okay. Explain the delayed symptom danger of certain mushroom toxins. Time-stamped case studies show how critical early action is. Case 1. Mushrooms consumed at 6 p.m. Family calls poison control at 6:30 p.m. based on better safe than sorry thinking. Patient receives activated charcoal and early monitoring makes full recovery. Case 2. Mushrooms consumed at 6 p.m. Family waits until symptoms develop at 2 a.m. the next day. Delayed treatment. Patient requires liver transplant. The psychological barrier to calling for help is real. People feel embarrassed about potentially overreacting. They don't want to waste emergency services on something that might be nothing. They hope it'll be fine and they'll feel foolish for panicking. Override these feelings. The potential embarrassment of a false alarm is infinitely preferable to the potential consequence of delayed treatment for genuine poisoning. Emergency services would rather respond to 10 false alarms than arrive too late for one real emergency. First responders need to know about mushroom consumption even if they're initially called for other reasons. If someone becomes confused or loses consciousness hours after eating wild mushrooms, paramedics might initially suspect stroke or other causes. Make sure someone at the scene can communicate the mushroom exposure history. The window for effective intervention is narrow with certain mushroom toxins. Activated charcoal works best within the first hour or two. Gastric lavage becomes less effective as time passes and stomach contents move into intestines. The sooner you act, the more options medical teams have. Remember, with mushroom poisoning, false alarms are acceptable outcomes. Real poisonings with delayed treatment are tragedies. When in doubt, make the call.